Hi, I'm Smriti and I'm basically from Bhubaneswar but settled in Bangalore from last 10 years. I was pregnant and it was 8 months of my pregnancy when I started developing symptoms of COVID and I got tested positive. So we contacted our known doctor Devasis who is practicing here. So I got admitted to his hospital because my saturation was dropping and my oxygen levels were low. So I was on oxygen support for 3 days, and afterwards when my situation got worse, he shifted us to Apollo by his contacts, and because I needed better facility and an ICU and ICU facility, so I was transferred to the Apollo Bannerghatta.
I still remember the day vividly when Dr. Dharmesh Agarwal, my cardiac anesthesiologist, and I were called in to initiate VV ECMO for this particular lady. It was a challenging case. She was just a few days out after delivering a baby via C-section. She was on a ventilator with 100% oxygen, and that was not able to provide enough of oxygen supply to the rest of her body. So we took a quick decision to initiate her on ECMO, by which we took the blood out of her body, added oxygen and returned it back to the body, basically allowing the organs to function. What was particularly challenging for us was that she was in some sort of sepsis, which took a few days to resolve, and it's all credit to the entire team, the cardiac anesthesiology team, the perfusion team, the nursing team, all the people involved in the ICU care, the critical care physicians, who I think put in their all to give an excellent outcome for this lady.
When she was admitted to Apollo Hospital, she was already 8 months pregnant when Smriti told. So she needed more care. So we trusted the SDU unit and ICU. And after she was admitted to ICU, the same day she was put on ventilator. And the next day, baby was delivered preterm. And because he was preterm, he was moved to NICU. And he was there for a month in NICU. And the doctors and nurses, they took care of him in NICU. That was the reason that I could focus my attention on Smriti's recovery, because she was put on ECMO after 3 days of LSCS happened, and she was there for 5 weeks on ECMO, and after 5 weeks she came out and she was put on ventilator for another week, and then she was discharged. Meanwhile, the hospital staff also supported a lot, even the SICU team and even the finance team. They helped in arranging for the public fundraising, how to do that. I never had done that also, because this ECMO treatment is also so costly, like nobody, we cannot afford it directly. So it helped, like everybody kind of pitch in at the right time, so that everything went on smoothly and in the planned manner. After she was discharged, so she was on the very minimal medication. So doctor advised what is the dietary plan we have to follow, what are the medication we have to follow. So we followed the same thing for Smriti, and she recovered slowly, and she is showing good signs of recovery now. And baby, although he was preterm, but because of the care that the doctors and the nurses took here in an ICU, he was like a total full grown baby when we took him to the home. And at home we took the same precautions and all that, because he has to be taken some extra precautions because of the preterm. So we took all the precautions and everything that doctors advised, and he is also doing fine at home. So both mother and baby are fine now.
The take-home message is that when ECMO is initiated for COVID patients, it's a long haul with outcomes in the range of around 35 to 40%. And a multidisciplinary team approach really helps when everyone puts in their all to ensure the best outcome for the patient and everyone involved.